सा खोल because so sometimes patient tune is very small tune and we are using like big finger, so maybe in 4 finger you will reach to here. Okay, so we'll respect the patient's finger. Okay, relax your body. Okay, so 1.5 tunes, go a little bit here. Okay, so
not too much, little bit.
Yeah, for the stomach we'll go little bit, otherwise all the point are very superficial. Okay, 2, and rain meridian is going from down to upward.
That is now 3.
Yeah, so it will be like 3 here, little bit more upward like this. Okay, so this is one triangle.
Yeah, one triangle.
Okay, one triangle on your head. So that will be same.
Yeah.
Okay. This one is one. Second one here. Third. This is the second triangle. Half triangle this one, half triangle this one. Then you can use your theory. Some G will come out from the hair, anything, because half this triangle bringing G, half triangle this, just for theory. The practical is only this.
Well, one is masculine and one is feminine, the triangles, no?
Okay?
This one is feminine and this one is masculine.
Oh, that's how it
This triangle is masculine.
The meaning of the triangle means the meaning of the triangle like this. Triangle like this.
And one is like earth and fire, isn't it? Or something like that?
I knew only that thing.
I think in alchemy one is earth and one is fire.
Okay, then we'll give the moksha, one more triangle, one round here, second round here, one more round here, one more round here.
So all of them can get moksha.
Yeah. So sometimes, for example, patient after the session they feel proper relief. Okay, but sometimes little bit they will start feverish. Okay, and little bit they will start to cold and cough. That will increase because acupuncture will not suppress anything. If there is more congestions, then that will start to reflexing first. Then the patient will heal the problem.
So initially it will increase.
Understand? And
so we should also put salt, right?
yeah, now we'll put the salt there. So you'll give the moksha like 1, 2, 3. Then give the moksha here.
Then
1, 2, 3. 1, 2, 3.
I have a question. If the person have problem of moksha says too?
Yeah, that's the some people having that issues. But
So what was the question?
Tell the patients just breathe from your mouth. You stop your breathing from your nose.
How can anyone do that?
If they're vata, they'll have a problem.
Yeah.
They'll be anxious.
Yeah, this will happen sometimes. Mostly you can suggest when you don't have sinus, come that day.
It will increase with मेरा अगर मुंह पे मोक्सा किया तो मेरा headache वापस start हो जाएगा.
So yeah, but if you, for example, during headache or during sinus, if you give the moksha, then that will increase little bit. But when you are feeling the normal, that day, for example, I have the vata sinus. Okay, so sometimes this moksha smell is irritating me a lot. But whenever, because sinus cavity, it stimulate on some specific smell, and this smell is not connected with your vata. This is my practical experience. But whenever once your cavity is stimulated, no, after that if you smell any smell, there is not a specific smell. Once your sinus cavity become active and you start to sneezing, after that any smell will give you problems. But when you don't have sinus, okay, and your cavity is not like active, on that day if you are using moksha, then nothing will give you problem. Okay, so call that patient when you don't have sinus, come that day. We'll give you sinus and go and start sneezing.
So this one is just for Bata.
This
Bata
is
process.
just for the vata sinus. Okay, this treatment is just for vata sinus.
And if there's so much trouble, just put the needles and leave it. If there's so much trouble that time, so you just put the needles and leave it.
Yeah, that they just insert needle, will not use the more moksha. समझता है
He wants the video.
Right. Sikhao. Okay. We'll go just one more step. Just we are going to add one protocol. This protocol called the name is GT. What is the protocol name?
Oh, general communication.
One of the favorite protocol in our okay. GT means
तो मैं बड़ा ठीक है
GT तो पता है ना Change this number point. Stomach 36. Brain 4. LI 11. And King 10. In this evening, if I go and do GT on that patient, that means this is the protocol. Huh? LI, large intestine.
S36, ST36.
ST36, stomach 36. In time here 36. Okay, mostly we avoid this U20 but there is something when we come on the U20 point then we will discuss about this.
And it's stomach 36, right? 36.
Stomach 36, ST36. Screen 6, ST36, RAN 4, LI11. You already know LI11. There is LI11.
Where?
There.
Huh?
This is the
Yeah, when we do this, there is a crease ending. That point is LI11. LI11 point is very good point for
for calm down
Headache,
You said to wake
heat and cold.
what I said. Just tell that if you're using anything, then
Heat and cold management.
what we discussed in that balancing your internal temperature from the external. Second, remove the negative energy. Third, I said like lubricating your large intestine.
Mhm.
Okay, and it is very good for your anxiety too. Remove the negative thoughts. Okay,
this we do in Bhutan.
right. So screen 6, mostly acupuncture, how we use, which side is organ, we use that side, that point is more. Okay, for example, spleen is on the left side, spleen is more. On the left side, we use the more on the left side. Why we use the stomach on the right side? There is nothing specific any scientific reason. Stomach is more on center. They are saying the stomach essence is releasing from the right side. And duodenum comes like this. Okay? But I don't know. I always try on the right side. There is good result on the right side. So I always use the right side. Okay? And again the intestine. The half large intestine on the right and half large intestine on the left. I use on the right side. The right side is more effective, and I was continuing with this. In my left side also, there is no problems. Mostly, for the general tonification, I suggest to insert minimum needle here. Okay. For which people we can use general tonification?
Everywhere.
It's general.
Yeah.
It's general.
Yes.
Generally like this, who having the needle phobia. Someone having needle phobia, use this 4 point. Okay, this 4 point is not that much painful. This all point are very short point, and this point is helping. The general tonification protocol is helping to balance your vata, pitta, kapha, three dosas. This general tonification point is help to balance the three dosa, vata, pitta, kapha. Okay, and this general tonification treatment is helping a lot for your GI tract. Okay, small intestine, large intestine, everything is helping a lot and calm down the body, relax the body, lubricate the body. Mostly it help like this general. When we target a specific disease, that time we use this specific protocol. But there is minor problems. For example, in like this tongue. Okay, you can use this one because this is giving lubrication in the body. If tongue is like white coated, so in that condition also you can use general tonification that help reduce the kapha also. Okay, and someone having a stress in this whole life, you can use this protocol. Sometimes if you don't understand the case, use a general tonification. Okay.
Where is the point?
Yeah, this first line patients and lots of the information you are confused. Use general tonification. General tonification is one treatment. If you use it anyone, this treatment will give you at least 10-15% positive result.
Even if they come with a sore knee. Even if they come with a bad knee.
That is the orthopedic treatment.
Okay.
Where is the point?
Digestion,
SP6.
emotional issues and
Or immunity purpose.
yeah, this related
Okay.
anything. So this treatment help.
Where is the point? SP6, CST36. We don't
Yeah.
know.
Like GT, can we do our GT?
Yeah, we will now practical. All the point 25.
All 25.
Oh,
What is
for
zero to 25?
acupressure, all 25.
That's fine.
Acupuncture,
Acupuncture?
all 25.
Yeah, little.
Yeah.
Yeah. On the stomach, sometimes we change the size as per the patient's size.
Because the
Okay.
patient is too much fat.
Yeah, but all the distal point on the head and the leg, we use only 25 cm.
Okay.
Because acupuncture point is inside the skin, the superficially fascia.
Okay.
So if you are crossing like that, then the same thing happen. If you are crossing rectus femoris, then you are treating the.
When do you know when to do the orthopedic or the?
When patients having the pain, we'll do the orthopedic. And with the orthopedic, we learn something which is the pathological problems too. You can combine the both together. Not at same session. We'll do one session for pathological issues. Then after the removing the needle, we'll do the one orthopedic acupuncture.
Okay.
For example, someone having like digestion issues, we'll do one protocol for digestion issues. The same patients having the like knee problem. After removing that, just for a few minutes or 2-3 minute gap, now we'll use this one because this needle are very superficial needle, and that needle will go inside the muscle. Okay. Lie down. One person will do the So I'll say like this, I'll explain only one time so your mind will be more active.